Hello, my name is Maxine Henry. I am the project co-director for the National Hispanic and Latino Addiction Technology Transfer Center. I will be presenting Enhancing School-Based Prevention Efforts for Hispanic and Latino Populations in the Changing Context of COVID-19, part one of a two-part series, which was originally presented in Spanish in January of 2021 by the project coordinator for the National Hispanic and Latino Prevention Technology Transfer Center, Dolga Michelle Zelaya. This presentation and transcript was translated from Spanish to English by Fabricia Prado. Welcome to our webinar. On behalf of the National Latino Behavioral Health Association and the National Hispanic and Latino Prevention Technology Transfer Center, we welcome you to today's webinar entitled Enhancing School-Based Prevention Efforts for Hispanic and Latino Populations in the Changing Context of COVID-19. This webinar is being carried out thanks to the collaboration with the Regional Center for the Northeast and Caribbean Prevention Technology Transfer Center, Northeast and Caribbean PTTC, and it will have a second part entitled Conversation Between Colleagues. That will take place at a later date. In the chat, there is a link for you to register and join us. My name is Dolga Michelle Zelaya. I am the project coordinator for the National Hispanic and Latino Prevention Technology Transfer Center. Today, I am accompanied by Mrs. Clara McCurdy-Curlis from the Northeast and Caribbean Prevention Technology Transfer Center. We will be your co-hosts for today's webinar. Before we introduce you to our guest presenters, here are some brief instructions about today's webinar. Let's start by introducing the National Latino Behavioral Health Association. NALBA is a nonprofit organization located in New Mexico. The mission and goal of the National Latino Behavioral Health Association is to influence national behavioral health policy, eliminate disparities in funding and access to services, and improve the quality of services and treatment outcomes for Latino populations. NALBA was established to fill a need for a unified national voice for Latino populations in the behavioral health arena, and to bring attention to the great disparities that exist in the areas of access, utilization, practice-based research, and adequately trained personnel. The NALBA's executive director is Fred Sandoval. Our objective is to provide national leadership on mental health and substance use concerns of the Latino community. NALBA's policy priorities are targeted capacity expansion of mental health services for Latinos, Latino behavioral health evidence-based practices, legislation to increase the number of counselors, therapists, and other behavioral health practitioners, funding for co-occurring disorders of alcohol and substance use, opioid crisis in the Latino community, and suicide prevention. Our PTTC is part of the TTC Network, a multidisciplinary resource for professionals in the prevention fields. PTTC Network was established in 2018 by the Substance Abuse and Mental Health Services Administration, or SAMHSA. The PTTC network is comprised of 10 domestic regional centers, 2 national focus area centers, and a network coordinating office. Together, the network serves the 50 US states, the District of Columbia, Puerto Rico, the US Virgin Islands, and the Pacific Islands of Guam, American Samoa, Palau, the Marshall Islands, Micronesia, and the Marina Islands. Our center has a national focus for Hispanic and Latino communities and the workforce that provides services to these communities. Our PTTC is staffed by Dr. Pierluigi Mancini, our project director. I serve as the project coordinator, and Priscilla Giamasi is our executive administrative assistant. Our center has a national focus on the Hispanic and Latino communities and the workforce that serves these communities. Now is the time to introduce you to Clara McCurdy-Curlis. Clara, welcome, and thank you very much for collaborating with us. Thank you, Dolga, for the introduction. SAMHSA's Region 2 Northeast and Caribbean Prevention Technology Transfer Center is managed by the Rutgers Center for Prevention Science, New Jersey, in collaboration with EDC, Educational Development Center. Its purpose is to strengthen the substance abuse prevention workforce through technology transfer activities, including the delivery of multifaceted training and technical assistance to improve knowledge and skills in prevention science and evidence-based prevention practices. We serve New Jersey, New York, Puerto Rico, and the US Virgin Islands. You can see where we are located on the map here with the orange circle. On the map, you can also see the other centers that make up the PTTC network that are located throughout the United States. Our regional center, PTTC, is comprised of Dr. Kristen Gilmore Powell, the director, Claire Neary, project coordinator, and Clara McCurdy-Curlis, MA, training and technical assistance coordinator. Well, now is the time to introduce you to our presenters for today. I would like to first introduce Shai Foxman as the director of the Academy of Mental Health and SEL, which is the social and emotional learning of EDC. He has provided professional development to help educators in school to promote SEL and student mental health. As a training and technical assistance specialist of prevention solution at EDC, he has also supported state agencies and continued to support community organizations to implement and evaluate effective drug abuse prevention programs. Now I would like to turn to Dolga to introduce you to Michelle Baroni. Thank you, Clara. It is an honor to introduce you to Michelle Baroni. She is the director of the prevention club called Club Mixtura for SETPA Incorporated, a mental health clinic located in Norcross, Georgia since 2006. She has had the honor of serving more than 5,500 youth and looks forward to continuing this mission throughout her life. Michelle Baroni says, "You can't save them all, but you can plant that seed of hope in each of them with a warm hug and a friendly smile." Shai and Michelle, welcome. It is an honor for us to have you both today. Shai, you may start your presentation. Good afternoon. Thank you very much, Dolga, for the introduction and for all of you for joining us this afternoon in our webinar. As Dolga and Clara said, today we're going to talk about substance prevention strategies across school systems. This is me before the pandemic without the beard. Before I start my presentation, I would like to hear from you. I would like to hear what kind of prevention efforts or strategies you have used in your communities. These can be strategies that you are using now in the context of the pandemic, or strategies that have been interrupted by the pandemic. So if you can, share your strategies in the chat so we can see what kinds of strategies all of us have used. Well, while I wait for you, please keep writing if you want to contribute your strategies in the chat, and I will follow with my presentation in the meantime. I would like to start my presentation by reviewing the fundamentals of the substance use prevention fields. Because although the context has changed due to the pandemic, the fundamentals can continue to guide our efforts even now in this changed context. And I want to start with the most basic idea, in my opinion, of the theoretical framework that has guided prevention efforts for many decades in the field of public health. The idea is that drug use is often a response to risk factors and the lack of protection factors faced by our young people. The idea is that if we can reduce the risk factors and at the same time increase the protective factors, we can then prevent substance use in addition to the consequences of substance use consumption. Another way of talking about the same idea of protective risk factors and how you can prevent not only the use of drugs, but also other symptoms is using this metaphor of the iceberg. The idea is that we can see and generally want to address the symptoms of problems that exist in mental health are caused by risk and protective factors. Those types of symptoms include drug use, violence, academic difficulty. But if we start to look below the surface, we can see that all problems with these symptoms and others are caused by problems related to mental health. These problems in the development of mental and behavioral health are influenced by risk and protective factors that exist in the individual context and in collective or community context. Now, I want to talk a little more about what we may mean by risk factors. First of all, it is important to understand there are different types of risk factors and that those factors exist at different levels in the individual's experience. For example, at the individual level, examples of risk factors include social disabilities, such as autism, or mental health problems such as depression or anxiety. When an individual suffers from these disabilities, that may increase the risk of using drugs. In the most intimate school level, family and friends, there are also risks. For example, the lack of support from the family or trauma in the family. Another example includes violence in the family or problems with friends if we do not have friends who support us. This also increases the risk of drug use. And at levels of school and community, there are also risks. For example, violence in the community. If someone lives in a community where a lot of violence occurs, that can also interrupt mental health development, and that can lead to drug use. But other examples also include the lack of connection with the school, for example, not feeling connected with teachers, with classmates, or with learning generally, and also barriers to health services. If we live in a community where it is very difficult to get health services, including mental health, that can also increase the risk of drug use. And at the highest level, we have society. It must also be understood that examples of risk, including poverty, discrimination in general, and discrimination against Hispanic people, which also increases the risk of drug use. Now, these examples are examples that exist in general terms, but we also know that these days we have another level of risks related to the COVID-19 pandemic. For example, let's see, on an individual level, the people who have individual health risks are, like people with disabilities. We know that this can increase our fear of the virus itself because that can cause more problems, and the fear can also disrupt mental health development, especially among children. Not only the risk they have, but if they have relatives, for example, the father or mother with a health risk, that can make the children scared and depressed. Also can create mental health problems in the long term and cause the use of drugs. Also, pre-existing mental health conditions, for example, in children or young people who already have problems with depression, the pandemic has only made the problem more serious. And that is important to understand, and so we know how young people can be helped in these situations. At another level, family and friends, we also know that the pandemic has caused economic problems, including unemployment. When a young person's parents are unemployed, this can also affect our behavioral and mental health. The disconnection of friends and family due to the pandemic, due to the need to stay away from each other to prevent the virus. And at the community level, the lack of structure or routines that exist when physically attending school no longer exist because children are going to school virtually, or when there is a lot of change between virtual education and in-person education. Also, the disconnections in the community in general. Community organizations have had to cancel many events or social activities that also have affected young people. At a higher level, the pandemic has also created economic uncertainty, which can also create a lot of stress in the community in general, including the family, and in the end, this can affect the youth as well. Now we are talking about risks, but we must also understand that there are protective factors that are also important because we can increase the protective factors to reduce the risk of drug use. Examples of protective factors in general also exist at these four levels. For example, at the individual level, there are children and young people who have had the type of individual resilience in a natural way, or by parents and teachers who have worked and helped to develop this type of resilience. Also, social and emotional skills, for example, managing emotions, being able to have relationships with trusted people, all those kinds of skills that one can develop can also prevent drug use later on. At the level of family and friends, having parents who support us, who accompany us, who help us with school, or who are a part of our lives, that is also a type of protective factor. Both that and virtual connections with friends. And I am obviously talking about virtual connections in the context of this pandemic, because connecting with friends during the pandemic in a personal way is more difficult. And also at the community and school level, it is very important that we remember that Hispanic culture is a protective factor. The beliefs, values, the importance of family to support each other, those are protective factors. The more we can increase the connection between youth and their culture and their Hispanic identity, the more we can prevent drug use. And also the support of community organizations. The more resources and activities in a healthy social life, in healthy contexts that young people have available to participate, that also reduces the risk of drugs. And at the level of society, when there are economic and social policies that can help families, that can help communities, this can also lower the risk of drugs. Now, it is important to understand that we are talking today about ways to prevent drugs in schools, obviously. Schools and teachers cannot help with reducing all these risk factors and increases of all these protective factors, but it is important to understand the whole context for two reasons. First of all, because it helps us understand what are the factors that influence the lives of our students. When we understand that these dynamic things in society, in the family, and at school impact our students, by understanding that we can help them better. And second, because when we develop a comprehensive plan for drug prevention, schools can begin to identify which are the risk and protective factors that exist in our community, or which protective factors we want to include in our community, and which ones are the factors that we can intervene and change. Doing this type of analysis can help us create prevention plans. In the field of public health, we offer 3 different types of strategies called substance prevention that exist in the more general continuum of promotion of health, prevention, treatment, and recovery from substance addiction. Within prevention, we have 3 different strategies. First, the universal strategies. These are the strategies that impact all students. For example, a program in school in the classroom. Let's say a program that develops social and emotional skills, helping all students to create resilience, and those kinds of skills that can help later in making healthy decisions. Then we have the selective strategies. Those are strategies developed to help students who are identified as having high risk of using drugs. For example, students who have been exposed to trauma, for example, to domestic violence or violence at home. We know that there is a great connection between trauma and drug use. Although trauma occurs at early ages, later in life, it can create drug use. So if we have selective programs that identify, for example, students who have been impacted by trauma, group psychosocial programs, for example, with trained staff, with the capacity to implement this type of program, which is selective for specific students, can also be helpful for drug prevention. And in the end, the indicated programs that are for students who have already started experimenting with drugs. For example, one of the many problems that we know that exists in schools is the use of e-cigarettes or vaping. There are many cessation programs to the use of nicotine through vaping for students who have already started using. Now, it is important to understand that when we talk about a comprehensive plan in school, we are not talking about choosing one strategy over another, but rather offering different strategies within these 3 categories of strategies. Now, for today's participants who come from the field of public health, I imagine that this model is quite familiar. But it may also be that we have people who come from the field of education. And for you, I want to present another type of model that is very similar, but that comes from the field of education itself. This is called MTSS, or Multi-Level Support System. It is a model that is used in an academic context. For example, let's say if it is used in the field of mathematics at the first level, there is the educational programs, the mathematics curriculum that is used in the class for all students. But at the same time, you can identify students who are struggling and don't do well in exams. Instead of waiting for too long until they do not pass in a class, you can start supporting them as soon as you identify that there is a problem. And it can be done at 2 levels. The second level is a small group, and the third level is more intensive at the individual level. As you can see, the 2 models are very similar, but each field has its own way of thinking, its language, its terms. So it is important to understand both, because when talking about prevention at schools, it is important to understand the language used in the field of public health and the language used in education. But also, in both cases, the idea is to create a comprehensive plan that includes strategies at the 3 levels of strategies. Now, one of the questions that we are often asked is, how early in age should we start prevention education? And the answer depends a lot on the type of program that you want to use. For example, I already mentioned in the education of social and emotional skills, or SEL, this type of program can be started in kindergarten or even earlier, which is start talking to children about social emotional skills. For example, how to identify when I am sad, when I am angry, and what I can do, how I can behave or how I can ask for help when I am sad or when I am angry, for example. These types of skills can be started at a very young age, and we know that when we develop these skills at an early age, when children are younger, these are skills that can help them make healthy decisions. For example, If they have a lot of stress or anxiety or depression, they will know how to ask for help, how to identify how they feel and ask for help instead of resorting to drugs to try to lower or reduce their emotions. So that type of education can be started at an early age, and you have to continue with it all the way to the end of high school because those skills will help in all kinds of contexts. Drug prevention and how to have relationships with people we trust. It can help us in college or work, so it can continue from kindergarten through the end of high school. Then we have two other types of programs that can be introduced later. For example, at the beginning of middle school in 6th or 7th grade to say 11 to 12-year-olds, the two types of programs include normative education, because in many communities, I know that it is not always in the context, but in many contexts, the use of drugs or substances is used by a small group of students, especially at an early age, 11 or 12 years. So we help these students understand that not the majority likes to use drugs and that this can help reduce drug use. The third type is resistance skills, which is also important when confronting someone who offers them drugs. I want you to be very quick and go through the steps of a drug prevention plan. Here are 5 steps. First, to build a comprehensive plan with all of these strategies, you have to start with building a team that includes the classroom teacher, counselors, psychologists, school principals, a team that represents the voices in the school community. Second, it must assess what are the needs and priorities of the school. What are the problems, for example, the risk factors that exist in that specific community, and what are the protective factors that must be increased. Third, evaluate existing efforts to improve what we are already doing instead of starting over. Fourth, develop an action plan that talks about what is to be added, what is necessary to increase, and what to change and what to keep because it already works. And fifthly, implement that plan and evaluate the efforts. Now, I have the last slide that speaks a little about the things to do during COVID-19. I know that my colleague Michelle is going to talk more in detail about these. So since my time is up, I'm going to go to the question and answer section. And if we can have more time at the end, we can come back here. Thank you, Shai. I want to thank the participants for sharing the strategies they see in their community. And there was also a space to share ideas. We have received 2 questions, so I'm going to read them. The first question is, would the language barrier be a risk factor or only discrimination? And can the use of masks aggravate or incriminate bullying? That is the first question from a participant. The question about the use of masks in the context of COVID-19, in my opinion, masks do not increase the risk because they are used universally. As long as all students wear masks, and if schools have policies that require all students to wear masks, that creates a context where everyone wears masks, then it does not change the risk to the individual. Obviously, if in a school only the students who are considered high risk, for example, those who have lung problems, if we only have them wear masks, then it can create bullying. But I believe that as long as the schools have universal masks, and that is important, I believe that it does not create problems. Thank you, Shai. What would you say about language as a risk factor? I don't know if I understand exactly the question. If it is about the students who do not speak English, well, for example, or who do not speak Spanish at school, if the question is if that can create risk, obviously, if in the context of school, if there exists discrimination against Hispanics or immigrants in general, then this can create risk factors. The solution is not that they do not speak Spanish, in my professional opinion. It is not to change the language, but to change the context. That is, it must be taught to all students the importance of respecting the differences, that we are all immigrants from a generation to another generation, and that each language has its beauty and many good aspects, and that if someone speaks a language other than English, that is fine. It is obviously in my opinion, but you have to understand the context of the school, what the community values are, and if it's really possible to focus on those types of values at the community level. Yes, thank you very much, Shai. We only have time for one more question at the moment, but we will have more time for questions later. Another question we just received is, At the moment in Puerto Rico, the students are not in the schools, they are at home. So how do they adapt to that reality? Yes, the truth is that I would like to see if you can go back to the previous slide because I have some ideas there. First of all, the problem with the virtual schools, there is no longer the structure and routine that is so important for children and education in the physical building. So an important strategy is to talk with parents, communicate with their parents, help parents maintain a type of structure and routine each day. That the children wake up early in the morning and start working, connect with the school virtually, or work on their homework and finish the day at the same time they would have finished in the presential context. This type of structure can help children to live in this difficult context. It is also important to see how we can continue to support the relationships that students have with their peers and with teachers, with trusted adults who work in schools. Obviously, it is difficult in the context of COVID. Certainly, there are virtual technological ways to do this, but also sometimes when technology is not available, families that do not have access to technology and have to think in creative ways. For example, I know some school centers where the teachers write letters to students and send them by regular mail so that the students know that the teachers write letters to help them know that they are still thinking about them, that they still want to support them and that they want to help them. So maintain this kind of relationship in which students know that there are people who will support them. This is important. Thank you very much, Shai. We will continue taking questions to respond later. Well, now is the time to welcome our second guest who will share with us her professional experience. Welcome, Michelle Baroni. Hello, good afternoon, everyone. My name is Michelle Baroni. I am the director of a clubhouse in Atlanta, Georgia called Club Mixtura. We are a level 2 support system for Latino youth between the ages of 11 and 17. It is a pleasure to be here with you. Well, during the pandemic, we have had to change many of our rules according to our contract to continue offering services for our participants and their parents. As a Hispanic woman, I have always taken into account that our community is quite unique and different from the others. Even within the Hispanic community, we have our differences. For example, the community in Atlanta, Georgia has needs that the community in New York will not experience. For example, in New York, especially if you live in the city, transportation is not a problem. Everyone walks to the grocery store and it is easier to acquire needed items. In Atlanta, it is not like that. You need a car. The closest store can be 1 mile or up to 5 miles from the house, and picking up groceries and taking it to the house can be very difficult. So we have had to change our strategies and modify them to support our families. When I start working with families, I always have to take cultural considerations into account and its planning. This can be during the pandemic or not. It does not matter. We always need to take into account our families. We have to see what the needs of the families are. Take that into account and help them or modify our program according to the needs of the families. We also have to take into account what the laws are, the laws at the local and national levels. So that does change how we have to do our programs. If the laws are harming families according to transportation, which is what I have seen a lot in my community, then I have to see what I am going to do to help the families with that. Also, in the county we are located, Gwinnett County, I have noticed that traffic-related changes have been implemented to help pedestrians cross the streets. There are more crosswalks to help pedestrians, so we need to take into account that we will need to go around our communities to help our people. Well, I know that we already talked about this a bit with Shai regarding the theme of risk and protective factors, but it is important to continue with this topic because we are going to help our families if we do not take into account their lives and their traumas. For example, cultural disparities such as immigration. I know we have what is called ICE, or Immigration and Customs Enforcement. This can be a great trauma for our clients. When a child arrives at home and his parents are gone because they have been deported, it can result in a traumatic event. I can't even imagine what is happening to these children. Discrimination. I know that Mrs. Cecilia asked about that in the question about language. Discrimination is a very large risk factor. Our parents stop seeking help because they feel the discrimination for not being able to speak the language. So the risk of use increases because they do not obtain this access. COVID-19 has also been a great risk factor. Children are bored. There are no activities to do. and cell phone use with the incredibly positive information, and I'm being very sarcastic when I say this, that does not help. And in the end, we can affect mental health, not only the youth, but the parents as well. I remember that my mother always told me, Michelle, when you are sick, that affects me too. So the mental health of the young person affects the whole family. We all know what the problems are, and I have always said that it is easy to talk about risk factors. But I have always felt, and this is my opinion, and I have seen that when we focus on the positive or protective factors, changes do happen. That for me is when they have that support, they can change. For example, peer support. When in the clubhouse, there are a group of young people of the same age and they have other children of the same age with them dealing with the same type of problems. They have that time to be able to talk about things. It is obviously different now because we are in the pandemic and they cannot be in classes, but they still have that time to meet and talk through Zoom about their problems and why they want to change. The guides and mentors. I have seen that it has been the most important thing for a young person. When there is a positive leader, there is a guide, a mentor, and it does not have to be one of the staff. That can be a pastor of a church, that can be a teacher, or somebody else. This is super important. Now, the community. We have seen in the community there are many parts that have many beautiful and fun things for the youth to do in the community, and having that is a protective factor for them. And family support. I will never forget when my mom and dad were in Florida. They were in a timeshare presentation, and one thing the man said is that the Latino families are usually the first ones to buy timeshares because we as Latinos are more focused and centered on the family, and we have more affection. We have that Latin warmth, and we are always with the family, and that is the most beautiful thing we have from our people. Okay, so now what are our risk and protective factors? And these are the changes we had to make. On the left side, we see immigration and customs control. We had the clubhouse that was located in a very central place, and for financial reasons, we had to move. And when that happened, we went to another place. We had a parents' meeting, and I told the parents we were moving from our place to another place. And suddenly, 10 parents of 28 children told me that they needed to withdraw the children from the program. When I asked why, they told me because the place where we moved was a place with many checkpoints. At that time, so at that moment, my priority is the children, so I had to figure out how it would work around this obstacle. So we had the organization bus that you can see, and we began picking up the children. When COVID arrived, that totally had to change because before we could open the clubhouse for a little while, but only a small number could ride the bus. And when the lockdown passed, it had to finish completely. We could not do absolutely anything. So we used the bus to run errands, to bring materials so that the children can continue with the prevention classes, which is the most essential. Okay, so how are we going to do the classes? As we are doing now virtually, since I entered this career and I began using the Too Good for Drugs curriculum, and I saw in the comments the lady said that she was using Too Good for Drugs, and I am not going to deny it. At first, I did not like this curriculum. I did not think that the youth were going to relate to this curriculum. Many of the names in the curriculum was like Ashley or Jacob, and I remember very well when I was teaching a group of girls, the girls and I changed the names to soap opera characters. So Ashley became Esmeralda or Lupita. It was so cute. What I do like now is that Too Good for Drugs has made some big changes to be more inclusive by introducing Latin names, Asian, African American, and Caucasian names, so that this is multinational for many people, and it is a big change. I love that they did it. The good thing about this curriculum is that it helps develop many positive norms, focusing on protective factors while teaching how to prevent substance use and abuse, but always putting protective factors first, such as the ability to set goals, decision-making skills, conflict resolution skills, effective communication, pro-social bonding from school, social emotional competency, and these are protective factors that are extremely important for the lives of our youth. What I also love about this program is that it is a universal program. I have already done this program for 15 years for children of 6 years old and even younger, up to 18 years old. They have a curriculum made specifically for the ages of each participant in the program. It is interactive and they learn a lot, but we do have to do it virtually. Well, each child, to make it virtual, had to take their study book home on the days of prevention classes. They follow the instructor having their book each day, and every book is addressing the curriculum specifically for the age of the youth. So if we are talking with youth in 7th grade, they would be following the 7th grade book. If they were in high school, they would continue with the book appropriate to the curriculum. The one on the right is for people in high school, and it is general for youth from 9th grade up to senior year, 12th grade. We always have to maintain the fidelity of the curriculum and not make changes without the author's authorization. But if you want to visit the website, https://twogoodprograms.org, they will teach you what their approved adaptations are so that you can apply it virtually. And how they instruct us, we have to run errands. We have gone to each child's house to bring them the material so that they can do the activities, and we are doing it via Zoom. Obviously, I like Zoom because they make breakout rooms. That way you can do things when you have to break down into small groups, and that for me has been very good. The deliveries have been a great help, and also we take into account the social networks. Although they can do something negative for children, they can also be something positive. I communicate with my young people in their own way. Their way of communicating is through Snapchat, and we have made videos through TikTok, and later you will see what I have done to catch up with the children. The Mixtura program also has another way of being able to communicate with my babies. We also do what is an alternative healthy activity such as art, sport, or dance, etc. And to continue with those, we made our YouTube page to do that. It is easy to send a video, but I feel that it is more beautiful that the participants see our faces and that they know that this video was made for them specifically. So if you are interested, you can enter our Club Mixtura page to see how we did it in the houses and how we did the workout. I took my models who are my nephews who helped me with everything, but it was effective. They could see that I am making the effort to communicate with them, and that was very nice. And finally, when everything is finished and they do their part and they have done everything faithfully, the alternative classes, the prevention classes and everything, the youth can then graduate. This is the most beautiful thing there is. You can have that time with your babies and say, look at all the effort you have made. You have done a great job, and there's no better reward for them than knowing that this was not in vain. They did a great job. It was a pleasure to speak with you. That is my entire presentation. If you have questions, please let me know. Thank you very much, Michelle. Now we have reached the time of the question and answer section of our webinar. As a reminder, you can ask questions to both our guests by writing your questions in the question and answer box, and I and my colleague Zolka will present your questions to our presenters. Thank you, Clara. Thank you very much, Michelle and Shai again for this nice presentation. We have many questions. We are going to start directly in the Q&A, and we are going to alternate. The first question is from Delphia Gutierrez, who says, if a person is already in recovery from addiction, but his parents continue to verbally abuse him, can he relapse into addiction again? And this question we are going to give to Shai. Yes, excellent question. What we know about addiction is that treatment or recovery from drug addiction is really a lifelong adventure. And obviously, if the problems that push somebody to use drugs in the first place continue happening, unfortunately, it is easy to return to that same addiction. So obviously, it is always important when a person goes to treatment for substance use. And I know what I'm talking about treatment, which is different from prevention. But when one is working with treating a substance use problem, it is important not only to work with the person, with the individual, but also to understand the context. If it is possible to change the context when the person leaves the treatment, if there are problems in the family sometimes, there is no other way to help them. So we need to see if they can be with another relative or in another place, because if the person returns to the same context, there is a probability of returning to the addiction. Thank you, Shai. Clara, you can take the next question. Thank you, Dolka. So the next question is from Viviana Suarez, and she said, We know that during this pandemic, domestic violence and sexual abuse have increased at all levels. Is there any educational class for students? Michelle, if you want to answer this question, that would be great. Of course there is. As I told you in the Too Good for Drugs program, we talk about relationships. That is seen in the curriculum of high school students. Obviously, they are at another level in their lives, so we have to take that into account. We talk about domestic violence, about how to report that, and we not only talk about it, but we also talk about the people around them who can help them. That is why it is important to focus on teaching our children about our guides and mentors, because when there is that trust with an adult person, they should do the work of fighting or advocating for the person. And the curriculum. I will only be able to talk about the Too Good for Drugs curriculum because this is the one I am using now. But I know that this is part is being talked about in the curriculum of the high school children. As I told you, that part has to be clearly spoken with the high school children. But the middle school children and elementary, and for the children in 6th to 8th grade, we need to talk in a way that they understand and that is acceptable. Thanks, Michelle, for your answer. Golga, you want to ask the other question? Yes, we have a good question. Well, it is a comment by Magdalena Bustillos, and she says, excellent presentation. I wish it could be given with more time because there is a lot of very interesting information, such as giving us more experiential examples. Also, I'm going to take a moment to remind you that we are going to have a second part of this presentation, and that is going to be having a conversation between colleagues, las pláticas. So we will have more time, but I would like to pass on this part to Shai to see if he can help us by giving more examples of experiences about how to support families during this time of COVID-19 and the transition of programs in schools to virtual and what we can do, how we can help them. Well, first of all, if the school is already using an established program, like for example, the one in the example given by Michelle, many of the companies that developed these programs, for example, in Too Good for Drugs, they are developing their own materials to help teachers to do it virtually. So the first thing I would do is contact the company that develops the program and see what kind of material, what kind of examples or strategies they already have to adapt programs for virtual schools. As I said before, one of the most important things to support children is that connection with adults who support them, and not only parents, but also teachers. So the example that I gave before, which for me is very important, what ways can the school work with the parents to support that connection, both virtually and in non-virtual ways? As I said before, writing letters, for example, visiting outdoors, passing by car and greeting the students because the students will know that the teachers have not disappeared. They are there, and that the people who have supported them in the past, they are still there to support them. This is something very important for all ages. Other examples that can be adapted, I think, and I saw that there was someone who also wrote that in the chat, is creating virtual groups if you can, because if you can do it in small groups, not with the whole class, but with a group of up to 5, 6, 7 students, whom we even once a week virtually with an adult, a teacher, a counselor, or someone who can facilitate the connection, because that social connection between peers is also so important. That is why at school, we always have different strategies in the classroom for clients to work with each other, promoting collaboration, because those are the skills that help promote those types of social and emotional skills that can help later in life. So try to adapt this type of work that you can do in the classroom, to do it virtually, and in a way that really helps the students to participate. Not only that the 20 students that are watching the teacher's presentation, but that they talk to each other. So that is why it is also good to have small groups. And sometimes, if you can't do a lot of this type of small group, at least do it for the higher risk students so that they have peer-to-peer connection with the teachers. I hope that these examples help you. Thank you, Shai. You make it very practical when you give those examples. Thank you very much. So to the next question, we turn to Michelle. From Gabriela Wing, the question is, what can be done with children who have special needs and are having a lot of stress due to confinement and no longer accept getting into online class? When you say special problems, like which ones? That's a good question, Gabriela. Maybe she could write a little bit more in the chat about what exactly she wants to say about special needs. because that does change a lot. This is a good point to clarify. Well, I can lightly cover this. Let's say if it's a girl who has an intellectual disability, I have seen that children with a disability are even more apt and ready and want to learn even more than other children who have not had their problems. Although they have their difficulties, the only thing they want to do is have a moment of de-stress. Now, it is part of the youth's mother or father to help, especially during the time of COVID, where we obviously cannot be there with them doing hands-on classes in person. We cannot help them. It is now part of the father and mother to be able to help us facilitate these classes. So we should have that conversation with the mother. If you want your son or daughter to participate, we will do it. We can adapt our program so that they can understand it too. But as long as we have that support from the parents, it is very important. And now Gabriela clarified that she was talking about autism, Down syndrome. That's good, I guessed it. Yes, well, thank you, Michelle, for your response and resources that you are sharing. Olga, I will pass to you for the next question. Yes, and I think that it is also important to remember the positive things in this pandemic, like the increase in telemedicine access. Parents who have a child with special needs can try to call those companies and mental health clinics, schools, and ask what resources are available to help. And right now, one of the great advantages is that with access to telemedicine, you do not have to leave your home. You can connect and seek help. The next question is a comment and a question from Margarita Perez Pulido. And it says, young people are now using drugs as a way to escape the current situation. Classes are on the internet and there is not a lot of interaction to address these drug issues. Schools must integrate a mindfulness-based stress reduction system in order to arouse curiosity about knowing themselves and how to relate to society. Do you have any comments on this, Shai? I think that comment is right. It's a very good comment. Many times in general, there are two reasons why some young people use drugs. First, to explore. It may be because they want to have the experience, but more often it is to escape types of emotions or situations where they do not have other resources. When the youth does not know what else to do, when they don't know where to ask for help or how they can ask for help. That is why they resort to drugs in order to escape the feelings, the emotions, or the problems that they have. So it is like it was said in the comment by the participant. We have to see in general what the alternatives are, how to teach young people the healthiest alternatives to manage the problems that they have. Mindfulness is a type of meditation, and there are many studies showing that this type of interventions help children, youth, and adults, all of us, to know how to meditate, how to pause the mind from our day-to-day thinking and be able to relax the body and mind. This type of intervention is very positive and helps a lot, and there are several other strategies as well, like physical exercises, running, reading a book, and picking up the phone to call and talk with a friend, with a relative that you trust. All these strategies of how we can help ourselves when we are suffering are very important. And can I add something, Shai? Sorry if I interrupt you. That is why it is so important that we give the children activities so that they are active during the day and they are not there bored or do not have time to be suffering and thinking about all the bad things that are happening in life. Because there are bad things happening, and that is why it is important to do our work. Since COVID-19 began, we have been working twice as much because making the YouTube videos going shopping was a lot of work, but it is worth it because now is when they need us the most, and we make the effort so that they are busy. Their minds need to be busy with positive activities. Sorry, I interrupted you. Perfect. What I would add to what you were saying, Michelle, is what I said before, also about the daily structure, daily routine, because when the students, the youth, have nothing to do, they go to sleep very late, they wake up very late, and not having anything to do is when they get bored or start thinking usually about all the bad things that exist in their lives. But if they have routines and they know that they have to wake up for an activity or a program that they have to do, if it is with school or a community program like Michelle's, all of this helps the students, and it is important that we, as Michelle says, must create opportunities. We must provide the tools and opportunities so that they can participate in positive activities. Thank you, Michelle and Shai. Yes, indeed, speaking of tools, I am also noticing more and more integration of mindfulness in schools. At least before COVID and with my children, the idea was present in schools, so I hope it grows and it is more used among the youth. Well, the next question comes from Roberto Paniguana. It is a comment and then a question. In Puerto Rico and here in Philadelphia, the entities of impact have very limited resources, and also sometimes there are many obstacles to work on the issue of substance use. Will there be a proposal so that these entities can receive the government endorsement so that they can work directly with the school without the need to obtain too many permissions? Michelle can answer this question from Roberto. Sure, I know that there are many obstacles to reach the funds because that is paramount, the funds. There are resources, but it is necessary to look for these resources. I have seen food drives. It is like an aid for families, for those who do not have food. The churches that exist throughout the United States. The churches are a great resource if someone wants to volunteer, and doing that is a great opportunity to help the community through the churches. Now, if that causes some discomfort because perhaps a person does not feel comfortable with the church, there are also community places. There are always with the same obstacles that you have, but they do not have the services or the funds either. And that is why it is so important to have the partnerships, the agreements. Then what I do not have, my friend will have. And what I have, my friend does not have. Then we should work together as a community to supplement what one does not have. So those funds can be pooled together and we can help people. That is a problem since I started with this career, that there are no funds, and that will always be the case, that we will never have funds to do things, but we have to know how to talk to people, seek our support in the community to reach our goals, to help people. That has helped me a lot. Thank you, Michelle, for sharing your personal experience. It is true that funding in our line of work is always difficult to find. Well, Dolka, passed it on to you. I love this last question because to develop prevention programs specifically in times of the pandemic, we have to be recursive and to try to collaborate. In collaboration, there is success. Collaborate with all these nonprofit organizations that we have around the US. Now, the next question is from Trinidad Bueno, and it says, what strategies can we have to recruit parents and adolescents in times of COVID-19 for our prevention programs? Shy? It is a very good question because working with parents is a big obstacle. Many times, and there are many reasons why parents cannot always help or collaborate because they are busy, or sometimes because the program is in English and they do not have the language skills, and sometimes because they do not know how. Well, one of the specific strategies that we have used in various types of programs is that parents collaborate with each other. That is, if one can find one or two parents who can create a program for other parents. Many times, parents do not want to come to school, or they do not know how to collaborate with the school. But for example, in my community here in Massachusetts, we have a social emotional learning program, and we wanted to work with parents to know how they can help clients develop their skills. So what was done before the pandemic, obviously, were book club programs where a mom or a dad invited their friends to their home in their living room. Obviously, this type of program is much more difficult with the pandemic, but still it can be done using Zoom, for example. But it is much easier to bring parents when a person who contacts them is another parent or someone who already knows them from the community, someone who they go to church together or that they know through church. This type of work with social networks is not only virtual, social networks on the internet, Facebook and all, which is also a good strategy, but also it is done in a more personal way. Parents talk to each other is also a good strategy. And like the youth, I think that the question also asked about the young people. When the youth contact each other, when they can find some young people who can't develop leadership, they can lead groups of other young people. That is normally more successful than when an adult tries to work with them. And another thing that I'm going to say is that we also work with the Massachusetts community in training and empowering parents to become community leaders. That is to find 2 or 3 parents or some parents who are very involved, who are passionate, who have the time so that they can develop their leadership skills with other parents. Thank you, Shai. Well, we have 5 more minutes to take questions, so I don't think we will be able to answer all the questions today because a lot of good questions have arrived. But as Dolka said before, we can also incorporate the questions in the next session. The next One is more like a comment from Margarita Perez Pulido, and she said, how little by little transformation the negative aspect that affects their safety and self-esteem. I do not know if the previous part of the sentence was missing, but I will keep reading. The success learning stress reduction can cultivate a different relationship with their emotions and the urge to use drug to claim their fears, etc. The success learning stress reduction can cultivate a different relationship with their emotions and the urge to use drugs to calm their fears, etc. It is important to increase the ability to be attentive to how they feel in those moments and that they can use their own internal resources and have access to their personal qualities. It is important to teach them not to judge, to seek patience with the challenges they live. Well, Shai, as a director of a social emotional learning academy, I don't know if you want to talk a little, and also Michelle, but I think it reflects a lot on your work. Shai, if you want to comment. I am 100% in agreement with that comment. This type of skill that is part of, let's say, different social and emotional skills. And one of these categories of skills is the way we teach children and youth to deal with their emotions. What to do when they are hungry or have fear. What type of resources, activities, or strategies can one use individually to calm down? And obviously, there are different types. There are different ways to do it. And that is important to teach them how to deal with emotions individually. But it is also good to teach them how to ask for help from an adult or a friend, because it is also good to have that social ability to manage our emotions. But if we believe that the field of meditation and all these types of strategies have advanced so much in the last 5 or 10 years, we know much more that it is not just something that sounds good, but that there is research that shows scientifically that this type of practice of having 5 minutes each day and just relaxing, this type of daily practice can help dramatically to lower stress, manage emotions, and eventually also prevent many of the risk behaviors, including drug use, suicide, and violence. So I think that all this type of program and strategies are very important. And I said it before, they are important to children, they are important to youth, and they are important for us adults too. If that is true, there is no one there who cannot benefit from meditation and being aware of our emotions. Thanks, Shai. Well, I think we have time for one more question. Dolka, what do you think? Sure, we're going to ask one more question, and I am going to first read this comment from Margarita because she says, sorry, the previous comment says that it was not a question. It is just that I got excited and wanted to give my opinion. I love that the audience is really connected with us and that they want to express in this safe space. And this is the time to talk about all these problems that we are facing with COVID-19. So there is no need to apologize. The next question comes from Annabelle Onigawa. What kind of reactions do you receive from parents when you ask them to keep their children on a fixed schedule? I know that the parents already have many things to worry about, especially at this time. And there are parents who do not even have a job at the moment and are under a lot of stress. At first, they ask me, Michelle, what am I going to do? What am I going to do if they're not participating? And I say we need to start with a good schedule, like we do with the baby. And a bedtime schedule at the beginning is a little difficult for a baby to go to sleep at their bedtime. Well, we are consistent and we help them. After time, they will realize that what we are doing is helping them to make their life easier. When your children go to sleep at the right time and wake up at the right time, they can also participate well in school. They can be vigilant and learn what they should be learning. Also, it depends on the parents because there are parents who are super good at listening to what we say, and there are parents who are already at their limit, who cannot take it anymore, and they do not know what to do. So we are here with affection, with humility and patience to tell them. We are here to support you and your son or daughter as well. We want to support them. I think that this way it will go well. And if it doesn't work, because we already know we can do it in the way that you're doing it, but I also want them to try to do something that is outside the norm, that they can see how the changes can happen. And I understand the parents, they are suffering and they have to think of the money, food, house, my child is inattentive at school, etc. They have many things to worry about, but this is an extra program. Soon they will see the children are having so much fun that what we are doing, and that you too, if you have a virtual class that you are doing, make it fun so that the children themselves want to attend those classes, so that they can continue, because that also depends on our work. If we are doing it well, they will come. Thank you, Michelle. Thank you, Shai and Clara. We would like to thank Shai and Michelle for today's presentation, for all the invaluable work they do for our communities, and for the time they have dedicated to us. We are now going to close the question and answer section, and we are going to continue with the closing of the presentation. Here is the contact information for the Northeast and Caribbean PTTC. Contact us for more information and to request training and technical assistance at no charge. We also want to let you know that we will soon be able to sign up to participate in our virtual conference that will take place on September 16th and 17th. The National Latino Behavioral Health Virtual Conference, Envisioning Latino Behavioral Health Equity in the Next Decade. If we were unable to answer all of your questions, please do not hesitate to reach out to our presenters. Here's their contact information. We hope you'll join us for part 2 of this series, Conversation Between Colleagues. Once again, thank you for joining us during our webinar titled Enhancing School-Based Prevention Efforts for Hispanic and Latino Populations in the Changing Context of COVID-19. Thank you. Gracias. Obrigada.